Welcome to the Community of Innovation podcast brought to you by the Center for Aging and Brain Health Innovation, otherwise known as CABHI. I'm Allison Schooler, Managing Director of CABHI and Vice President of Research at Baycrest Health Sciences. And today we're excited to embark on a three-part podcast mini-series in collaboration with Baycrest at Home. And I'd like to introduce Simon Cheeseman, who's the Director of Baycrest at Home, to share a little bit about who and what this program is at Baycrest. Simon.
Hi, Allison. Thanks very much for having me, and really excited to be part of this mini-series of podcasts. Baycrest at Home is a new service from Baycrest that's directed at folks who don't live on our campus, which is 99.9% of everyone in the world. It's meant to help older adults and their families who wish to remain living in the community and in their home, but are beginning to experience some struggles around those things. And it's especially for families that are dealing with issues associated with cognitive decline and dementia. And it's an effort to use technology to bring a lot of the expertise that's here on the Baycrest campus out into the world in a way that's useful, scalable, affordable, things that weren't possible before we became such a connected world. And with COVID-19, the need for this service has become much more acute. We've been involved in a lot of the more emergent initiatives that Baycrest has taken on, both here on the campus and now increasingly focused back out into the community to take things like social recreation and things like medical assistance and health and wellness counseling, as well as support directly for the caregivers that are so important for helping people stay in their homes and bringing it back out using virtual technologies. And part of what we're doing is bringing together information and guidance for caregivers and older adults in a variety of forms, including things like podcasts. So this is really part of that, and we look forward to making the information from this conversation available to everyone.
Thanks. And for folks who don't know, Simon was one of our leaders in CABHI before he moved on to take on the Baycrest at Home Challenge, and he was one of the originators of the podcast. So we're especially happy to be continuing that relationship here. So thanks for being here, Simon. Thanks for co-sponsoring this sort of mini series of our podcasts.
Thanks, Allison, and thanks everyone.
Yeah. For today's podcast episode, we're focusing exactly on the kind of things that Simon was talking about. We're going to dive into this much talked about topic during the COVID-19 pandemic, which is social isolation. We're now over 3 months into a pandemic-induced quarantine here in Canada and also across many countries in the world. And we wanted to explore a little bit more about what social distancing and the resulting social isolation has meant for older adults. How have the circumstances around social isolation evolved over time? What new challenges have emerged? What does the future look like for older adults, as many are continuing to self-isolate, and it's not clear when that self-isolation is going to be ending? And especially from the CABHI perspective and the Baycrest at Home perspective, we're really interested in how innovation can improve the quality of life and address the challenges that people face as they're experiencing these issues of social isolation during the time of COVID-19. So today we've got an amazing panel of guests to discuss all of these issues. And I want to introduce the panel just to start. So when I describe you, just say hi, and then we'll move on, and then we'll jump into the discussion. So the first person in no particular order, to introduce is Dr. Christine Overall. Christine is a professor emerita of philosophy at Queen's University in Kingston, and she's also an elected fellow of the Royal Society of Canada. She's published 11 books and several hundred papers on bioethics, philosophy of religion, and feminist philosophy. And although she is now retired officially from the university, anyone who's ever known any retired professors know that professors never really retire. Christine's really quite still active in research. She's a failed retiree in some ways. But we are very happy that she's here. She's also on a personal note been married for 47 years, and she's the mother of 2 children and a grandmother of 4. Notably, though, Christine does not call herself a senior citizen because she says there's no such thing as a junior citizen. Instead, she calls herself a geezer because she wants to try to preempt ageism. So, Christine, welcome.
Thank you so much for inviting me.
Glad to have you here. Kathleen Ellis was born in Toronto and moved at a very young age to South Africa with missionary parents, and she lived there during the apartheid era. And her first career was as a librarian. working at Western University and special libraries in Vancouver. And eventually she changed focus to program development and management in the nonprofit sector, where she focused on people with disabilities and supported employment, human resource management, and volunteer coordination. Now in her retirement, which you can tell is also not a very successful retirement because she's too active, Kathleen has moved to Norfolk County, Ontario, and continues to be an active volunteer with a number of community organizations. Welcome, Kathleen.
Thank you. Hi, everyone.
Avi Price is the co-founder and chief operating officer of Uniper Care Technologies. As a serial entrepreneur, Avi's on a mission to make a positive dent in the world to reduce social isolation and support active and healthy aging. With a background in business strategy and customer development, Avi has been involved in the leadership and marketing of several e-commerce startups. Since 2018, he's been a proud member of the Los Angeles Alliance for Community Health and Aging, which is a strategic alliance in Los Angeles to increase the reach of effective evidence-based community health interventions, as well as an active member of the Social Isolation Impact Coalition, which aims to devise a national program to combat social isolation for older adults. Avi, welcome.
Thank you.
Just so people know, it's very early in the morning for Avi, so we especially welcome his willingness to join us at this early morning LA time.
Oh, well, just on that, I have a 1-year-old and a 4-year-old, so 6 a.m.
So you don't sleep anyway?
No, it's not that early. Two of them are already jumping on me before 6, so don't worry about that.
All right, great. Dalas Forget is the finance and operations manager for Timiskaming Home Support. With a background in outdoor recreation, parks and tourism, and occupational therapy. Dalas was an owner for over 12 years of several home medical equipment and service companies. And in 2017, he joined Timiskaming Home Support, and in partnership with the Timiskaming Health Unit and funding from CABHI, he launched the Seniors Center Without Walls. And that offers educational and informational sessions, as well as physical and cognitive exercises to build community and combat social isolation. So welcome, Dalas.
Thanks for having me.
Thanks for being here. So we want to start the discussion off with just a discussion about what is social isolation, what is the problem that we face with social isolation, especially in the time of COVID. And there's a number of different concepts, words that weren't even in our vocabulary a couple of months ago that are now very common in terms of social distancing versus physical distancing. There's a much greater understanding about some of these issues around social isolation and so on. So I'm wondering from your perspectives, how has this issue of social isolation been redefined in the time of COVID? And what are some of the new ideas and issues and concerns that we need to face, especially in the context of thinking about geezers, senior citizens, older adults, whatever term you want to use, living in Canada and around the world?
What I've seen with COVID is that a younger cohort is seeing the effects of social isolation, where we, found that we were targeting the geezer group, if you will, in the past. A younger group of individuals is seeing that, and as such, getting involved in the potential solutions, if you will.
So it sort of raised awareness in some ways that there might have been issues of social isolation. All of us who work in aging knew about these issues before, but it may be that the awareness of social isolation and the impact is growing, which is a hopeful sign, it sounds like you think, Dalas. Would others agree? Or Dalas, go on.
Yeah, well, it is. I think it is hopeful in the sense that, sometimes you just don't know what you don't know. And until you've experienced social isolation, you don't know what it's like, and you don't know the actual need for a solution.
Yeah, it's interesting. Yes, Christine.
For me, the predominant feeling through this has been a feeling of grieving. And that's something that I didn't anticipate. Because social isolation just means a series of losses. It feels as if over and over and over again. So, for example, I have not been able to be with my 4 grandchildren for over 3 months. That's a time and period in their life which is huge because they're very little. They're all 7 and under. I'm missing out on that stage of their lives. In addition, I have a mother who's almost 94. She's in a retirement residence in Toronto. At this point, I don't even know whether I'll get to see her again. I don't know how much longer she's going to live. So I feel as if I'm grieving serious losses within my family relationships as well as with my friends. And on top of that, of course, it makes it that much harder to do the kinds of things that I had thought of as normal during my semi-retirement, like travel, like go to conferences, like meet with colleagues, attend lectures, even just to go to the library. All of these things have ended. And so for me, it's been a period of grieving in many ways. Not
That's
to
really
say that there aren't positive things, there are, but grieving has been a central feature.
That's a really interesting term. And because people often will say, well, you've got FaceTime or Zoom or whatever. So presumably you're doing those things, but it's not necessarily filling the gap in the same way. Is that right?
Not nearly enough. I think that it is indispensable to be in actual physical contact with or physical proximity with other people. Simply seeing them on a screen is certainly better than nothing, but it does not substitute, in my opinion.
Yeah. Kathleen, you agree or?
Oh, totally. I totally agree. And I hadn't actually put the thought of grieving to some of the things that are happening. So thank you for that, Christine. What I was thinking as well is some of the things that we do as seniors or geezers is to stay in contact with each other, to be a support for each other. And, just sort of spontaneous. Oh, let's go for coffee. And nothing is spontaneous anymore. In order to even, we were talking about getting a birthday party together. In order to even meet with someone, I went and had coffee with a friend a little while back and had to make sure that, the coffee that I picked up, I had gloves on so that I wouldn't, when I was touching her coffee, and everything had to be separately bagged, and we were going to sit out on her deck, but it was raining, so we ended up sitting on her porch with, 6 feet apart and trying to be very careful not to kind of cross each other's paths. And so, as I say, there's nothing spontaneous happening really anymore in terms of any kind of face-to-face or social interaction. And so that is part of the social distancing and the social isolation that I think we all feel. And sometimes it's like, just can't be bothered. You know what? I'll just phone you. I'll just connect with you through FaceTime, that type of thing. And so that whole aspect and some of the things that as seniors we went to as a group, they're not happening. So we don't get to connect with each other that way. And so our support systems are we're struggling to keep them together for each other. We know it's important because a lot of us are on our own or, need to have the support of each other. But it is a struggle to keep those going right now.
Yeah, it's interesting that the lack of spontaneity is something that is very interesting. A friend of mine hosted a cocktail party, and you've probably all been to cocktail parties in the past. And it had to be arranged in advance that there are going to be, X rooms on Zoom, one for the bartender and one for discussions of this and one for discussions of that. And everyone had to get a certain kind of, mixer and drinks in advance so we could all share the same experience. It was it was fun, obviously, but it was not like a normal cocktail party, that's for sure. And yeah, Christine, you wanted to add something there.
I just wanted to add that my oldest cousin died early on during the lockdown. So I was not able to attend his funeral, obviously.
Yeah.
There was quite a wonderful Zoom celebration of his life. And I think everybody, including his widow and his children, appreciated it, the whole family, all his friends. But it's just not the same not to be able to be present at an event like that, which is urgent. A lot of events can be rescheduled. So hard as it is for young people, I think that Graduations can perhaps be rescheduled. Weddings, that would be painful as well. But a funeral is not something you can reschedule. I guess they can have later another celebration of life, but I really would have liked to have been there with my family right after his death in order to support them and so they could support me.
Yeah, it's really clear that although, as you guys have said, these technologies have been helpful in filling some of the gaps, it's clearly not serving as a substitute, right? And this is the issue that's come up is, as things are opening up, who gets to go out, right? Because it's not clear. In some places, they're actually saying that older people, geezers, whatever you want to call them, older individuals should be the last ones to leave their homes because they're at the highest risk. So it's the first ones in, last ones out kind of context. So I know, Christine, you've got some thoughts on that, and Dalas and Avi are free to jump into it, even though we're not talking about Uniper and your other innovations yet.
Yeah. I think that this is potentially a really big problem because I think that as different areas, different provinces, different states start to open up, the tendency will be to think that it's important for younger people to resume their lives, which it is, but that the burden of protection will then fall on the vulnerable groups, including older people and people with disabilities and chronic illnesses. And then the expectation will be that we will continue to self-isolate, keep ourselves away from other people, while everything else more or less resumes, goes back to something like normal. So I feel as if the burden then is going to fall entirely on us under the guise of protecting the vulnerable. And I worry that that will stigmatize older people even more. We'll be even more separated from society. And I'm concerned. So I've been concerned for some time, even when I was middle-aged, but as I've gotten older, that there's a kind of damned if you do, damned if you don't sort of approach to older people. On the one hand, we're kind of blamed if we're not fully participating in society and contributing to society, and then we're considered to be a burden. On the other hand, if we do participate, prior to the pandemic, I think the thought was, well, then if you do participate, maybe you're taking work away from younger people. The form that it takes right now is that you're damned if you do participate, because then if you get sick, I feel as if we're going to be blamed. Well, it's your fault. You didn't continue to self-isolate. So I feel as if all the responsibility will fall on us. We're going to be even more invisible. It occurred to me the other day that people are not out demonstrating on behalf of elderly people. And there's a reason for that. Elderly people are not very visible, and we're going to be even less visible with the requirement that we continue to self-isolate.
Yeah. First of all, I totally agree with the high level, and obviously with all our challenges. And if we take a step back, and I can't presume to understand what it's like, because I don't have that same fear when I step out. Maybe in the beginning there was a bit more, and I used to travel out, but nothing comparable. At least because that's what the media is telling us, that where the risk lies. I'm looking at these, and if we take a step back, it sucks. That's reality. It's tough now. And when we're looking at maybe silver linings, when we're talking about this disconnect between the generations and looking at ageism, and there was, so maybe that's a silver lining, because all of this was here prior. The ageism and the disconnect between the generations and everything that's going on. Loneliness and isolation has been, the highest prevalence way before as an emotional condition, more than anything else, more than physical conditions. And today, maybe the only silver lining around that is, hey, we're talking about it. Everybody's talking. New York Times is publishing once a week an article about, loneliness and isolation and generation disconnect and how to cope with all that. So that's at least, the only thing, and we actually reposted a few of those around exactly that. Maybe now the world will start, putting that into high priority, and the challenge, the way you described it, Christine, is quite a challenge. I mean, how do you stay active and without being a burden on society and with that, and we can discuss that also later. We have different ideas on how that's achieved within community settings, etc. And it's not a substitute. It's not a substitute to going out and being with families. And also technology can never change that. And we're a tech-based company that creates virtual interactions, creates virtual, or we call it remote because it's very real. It's just remote connections, and you can't compare it to physical. It's just a spectrum. And today, reality changed the fact that there is no physical so much. And anyway.
Well, Avi, could you say a little bit more about what it is that Uniper actually does for people who don't know all the details, and what you're doing to address the need for social interaction and purpose through the sort of platforms that you're developing, and especially how you've pivoted in the COVID times, and how you might pivot further. And then Dalas, we'll turn to you, and you can talk about your solution as well.
Yeah, sure. So basically this was pre-COVID. We started it in 2015, the company. What we saw was it started from personal reasons of burden and disconnect. Everything we're talking about, loneliness, isolation for family members. And then we said, okay, how can we connect them? It started actually with connecting to families through accessible tech. And we always felt that there was not exactly, spot on. And then we started partnering with senior centers and just turned them into broadcasting stations for people that are more frail or a bit more homebound and can't go to the senior centers anymore. And they asked us, can we just test it out and see what happens? And we said, yeah, let's see. And then we turned on the switcher, and it was that light bulb moment. We saw people, just like we're doing now, older adults that are now frailer or at home, can't leave. We're talking about Canada for 6 months a year, can't really leave. The homes,
that's
some
not
people.
true in all of Canada, just so you know. But
okay,
yeah.
No, I'm not trying. Northern Canada.
He's Los Angeles in his Israel perspective.
Yeah. And anyway, that's so they're just connecting people at home to one another into a sense of community through a technology that makes sense to them. It started with a TV set, so taking any TV and turning it to become interactive. So now it's a two-way channel for people at home to connect with one another, almost like what we're doing now, only very, very accessible. And once we saw that was working really, really well with very, very high engagement, we said, okay, what else can we do? Once, technology isn't an issue anymore and isn't a challenge, and social connection is the key to drive, behavioral change, what else can we do? And our mission is to allow, every person in the world to essentially age in the place that they call home for as long as they wish for, happy and healthy and independent as much as possible. And then we work very closely with our members and with our care partners to really see how we can support that and how we do that. Technology is never the goal. It's just, a way to achieve, the outcomes that we're looking for.
That's great. And Dalas, do you want to share a little bit about what the Senior Centers Without Walls approach is?
Sure. So the approach to Senior Center Without Walls was to use the lowest possible technology to achieve, very similar things to what Avi's goals are. We thought, because we're in northeastern Ontario, the population we were initially targeting, which is seniors, geezers, folks who are socially isolated, just about everyone would have a telephone. And so essentially what the program is it uses teleconference technology to join social groups together for various activities, guest speakers, exercises, all kinds of different group participatory activities. So we did that recognizing that, the hope was to be able to scale it and eventually bring technology into the fold. COVID sort of ramped that up for us. We, from our perspective, what we're seeing is participants in the program who aren't our core original target participants. And I think, as I alluded to earlier, what we're seeing is a more general public recognition that social isolation is an issue, and it's a complicated issue. But we've got some younger cohorts now involved in the program, and I always felt that the Senior Center Without Walls, we targeted seniors who were isolated. What I think is the more appropriate way to look at it is less socially active than they want to be. And so, I always explain the program to people in this way. You go to work every day for X number of years of your life. You're whether your work is on a factory line or in an office or, as a grocery clerk, it really doesn't matter. It's social. And then when you retire, you need to actually work at keeping up that level of social interaction. And as it goes away, it becomes more and more complicated to continue to build. And so Senior Center Without Walls gave that social connection, that community building that a senior center would without actually having physically leave your home. I agree 100% with Christine and Kathleen. It is not a substitute for physical social interactions.
I was thinking while we were talking about, the effects of us seniors isolating and what that will mean for us. But the other thing, one of my activities, as a failed retiree, is to be the volunteer coordinator for a local community theater. And I'm also, an active volunteer, as Christine is, in many activities. And what I've noticed is that when we organize volunteer appreciation events, it's this active seniors who are the backbone of many organizations and services in the community. And with all of us basically out of commission right now, there are, services are not happening. And activities are not happening, events are not happening because we're just not there to put it together because we've been told basically to stay home, and so things are closed down. If we continue to self-isolate as we're being encouraged to do, what's going to happen to all of those services? It's not only an impact on those of us who are still active and want to be active and, fulfill our passions and our goals by being involved in these services and giving back to our community. There are services that are just not happening, and I don't see them coming back in the foreseeable future unless seniors feel safe enough and are able to kind of be part of those organizations again. Because, as I say, we are the backbone of many organizations.
Avi, what are your thoughts on that?
So, first of all, again, I agree. I mean, there's nothing to agree or disagree with that. I think that's the new kind of reality, and things are going to change dramatically. From flights that are not happening to people not going on vacations, to restaurants being closed, to weddings being canceled for the next year or so. And I think us is starting with us, and then nuclear families, and then growing into societies. How do we adapt to that and still understand our needs as humans in a society and try to cope with what is. And I'll just give an example of things that we're doing in that. And a lot of what we're doing comes from empowerment, meaning understanding that the people that we're working with, have to come from a place of empowerment. And what we're trying to do is, we'll take you two ladies as a prime example. You have so much to give. And there's so much resources out there that just not being I'm sorry for using like an economic term, but leveraged or utilized. And it's a win-win. So it can be back to the way, like you were talking about volunteer, the way you know it, but things can change. And I'll give an example, and that's now we're promoting like a peer-led mentor-mentee groups, and it's with people like yourselves that can now lead. And there's so much you can still give back, and it's good for you. It's good for others, and it doesn't have to be volunteer. By the way, one of our visions or missions is also okay. There's so much also maybe paid resources that can be utilized from the community, and it doesn't have to. I mean, it just requires changing the way we think about things more than anything else, because it may be a bit different than what you were thinking about. I mean, it's all still there. All we have to find is how to make that right connection. How do we find to make those matches happen, and then work with the people to drive that change. And it's not going to be the same as the physical world. And there's no, we just have to release that. Things changed. Now, how do we cope with that?
Yeah. And Dalas, I would think that you talked about the younger folks chipping in to help with this, but presumably you have a number of older volunteers, or there'd be room for older volunteers too, to be helping out. Is that part of the strategy also?
It is very much so. Many of the participants actually find their place in the program, not only as a participant but also as a host of something that they're passionate about. We have one individual who absolutely loves old time radio. It was one of his things, and so he became the host of a program, and it he drives it, researches it, and implements it, and brings a huge crowd to every activity. And so I agree, Avi, the potential to be to volunteer, to give of yourself, and to feel that community is there. It just is very different.
Mm-hmm.
Yeah. The one thing I'll add just on the volunteer front, and then Christine, I think you want to chime in also, is that there's research that actually came out of Baycrest and other places suggesting that the very act of volunteering is correlated with enhanced cognitive function. So it's, all of these sorts of things that are in place, in society. We know that there are ways to stave off cognitive decline. Volunteering is one of those. And it may be because volunteering is enhancing your cognitive activity. It may be because it's decreasing your social isolation. It may be because it actually, in some cases, increases your physical activity, depending on the nature of it. But for whatever reason, volunteering actually is a protector against cognitive decline. So whatever we can do to make sure that's continuing would be terrific. Christine, you wanted to chime in, I think.
Yes. Well, I just wanted to say I really appreciated what people have said so far, and I'm sure Avi is right that we have to adapt to change and things won't be the same as they were. I just wanted to mention one, for me, troubling phenomenon I've noticed. I've been taking part in a kind of ongoing study out of British Columbia of the effects of COVID-19 on people. And I also recently took part in another study coming out of Ontario. And in the second one, I noticed that the researcher, when asking the age of the participants, classified everybody as 65 and up. So there were 18 to 30, and then 30 to 45, etc., and then 65 and up, as if people from age 65 to 105 are all in the same situation. And I think that the kinds of initiatives that Dalas and Avi are talking about actually recognize that people are at different stages in their lives as they age, and a 65-year-old is not the same as a 90-year-old. And any kind of research, any kind of effort to support aging people as we age has to take into account that we're a very diverse, heterogeneous group. And I don't always see that. So one of the things I'm concerned about, and this connects with what I said earlier, is the tendency, if all of us who are vulnerable, who are over 60 or 65 or 70 or whatever the current cutoff is supposed to be for age vulnerability, if all of us are engaged in various degrees of physical isolation, that's going to contribute to the tendency to see us as a homogeneous group. And we are not. And that really needs to be recognized by researchers, by providers, by service providers, and by the general public.
Yeah. What suggestions do people have to address this heterogeneity issue? And it goes beyond age, obviously. I mean, there's, an increasing recognition in the research community and in the broader public that we have to recognize people of different racial backgrounds have different needs. People living in different communities, different needs. We've got people on the podcast who live not just in rural communities, but rural northern communities. And there are different needs there. That's where they have less time to go outside, Avi, not just in like Southern Ontario. But so how do we make sure that we're addressing all of those different needs with does it take 1,000 different solutions, or is there a way that the kind of solutions that you guys have in place can be adapted in different ways? And what other solutions do we need? Yeah, Avi.
Thanks. First of all, I totally agree with Christine, what she said. There is some movement now already. You're seeing, definitely in research, there's breaking it up by age. So 65, 75, 75, 85, 85, considered oldest old, etc. And also there, I think also we sometimes fall into ageism because it's not always age. Because we also see we sometimes have 85-year-olds that are cognitively, physically, mentally stronger than 65-year-olds, and also tech savvier, much more. So age is just for us, it's easier as a benchmark. We know it's not enough. And what we do, back to your question, Allison, is we have intakes and assessments that are done, both standardized scales to assess, different, health conditions, but mainly in addition, we also have a lot of goal setting and wants, meaning what are you trying to achieve with you joining, the program? What is the main goal for you? Where do you want to go with that? Again, as basis of the motivation interviewing and empowerment. And then, because it's not only treating age as a sickness. It's on the contrary. We used to have this. I used to have this talk. And there's the silver tsunami, and that's such a negative, saying tsunami is destructive. It kills. And then saying silver tsunami, and I had a question mark after that. Really? Isn't it like success for mankind? We're living longer. This is a good thing. It's not a challenge. It's not a problem. It's good. This is what we wanted. We wanted to live longer. Okay. How do we cope with that? How do we do it in a way that makes sense to us and to our loved ones? And I think that's where it needs to go. And it comes from looking at the whole person, looking at the needs and the wants of the people, and working with that in order to make that a reality for them and for us as a community. Yeah.
What needs do you think are not getting met right now? Where is there still room for innovators to be stepping in? Yeah, Christine. You people who can't see, her head whipped up so fast.
Well, this is something I've thought about a lot over the last 3 months, and I do have a number of suggestions of things that I think would definitely improve my life, and I sure hope somebody is working on them. So, for example, one of the activities I engage in several times a week is a group singing, which involves people from all across Canada, and we often get people internationally. So here's the problem with this. We use Zoom as the platform as we are using right now, but you can only hear the person leading the singing because it's only possible to have one person making a sound at once. It would be wonderful if there were some way in which we could hear from everybody at once, just as we can also see everybody at once. And I also think this would be a little more natural, even just for things like seminars or meetings, the kind of constraints that are placed by the Zoom system on having one person talking at a time and then the sound cutting out if somebody else tries to intervene makes the situation a little more artificial. But it would be particularly useful for musicians. I'm telling you, that would be a wonderful thing.
But one thing that's sort of interesting is if people are working on this, because part of it's the compression, data compression issues, and there's all the technical sorts of things. If this problem can get solved in a way, even video conferencing, I mean, Zoom and others are so much better now than they were just 3 or 4 months ago, because they had to get better because everyone's using them now, right? And so I think that this almost presents a real opportunity for us. In a country like Canada, the government had committed, I think in the last election, to have broadband internet available everywhere in the country, so, which is really critical if we want to address some of these issues of social isolation, because increasingly, although there are some like Dallas, your solution could use telephone, a lot are relying on internet access. And so, there's a push now, I think, to move some of the foundational technologies ahead. So if those advances are made, it will benefit us tremendously in the future. So, meeting the needs of older adults today is going to benefit everybody tomorrow, is one way of thinking about it. Yeah, Dallas.
Yeah, isn't that the silver lining that Avi was alluding to earlier? We're being forced to make things better right now, and we're being forced to see social situations that we, as a population, didn't want to see or didn't want to address before now.
We really have to address the needs of COVID so that we can get back on track for addressing these other issues. So that in some ways, the two kind of fit together. They don't have to be in opposition. I'm wondering what your thoughts, Dallas, are on that, and how Senior Centers Without Walls can bring the generations together.
So the beauty that I felt with Senior Center Without Walls as the coordinator initially was that, because we live in such a small, remote northern community, we, sometimes can't have a guest speaker at a senior center who is the best person to bring information. Oftentimes it's just whoever's local and might understand the topic. So with Senior Center Without Walls, because it's telephone based, we can have the best of the best, because everyone has a half an hour to give, to volunteer, and to bring things forward. And so we had some really excellent guests. And, one of the conversations that the group of initial participants brought forward related to sort of the environment, in the sense that, we would often have invited people to come and speak, and they would have traveled from say Toronto or Ottawa and driven and consumed and polluted and all that to get to our area. And there might only be 16 to 25 seniors able to come to the presentation anyway. Where with Senior Center Without Walls, we're able to do that sometimes twice or 3 times a day with guest speakers from all over the planet, not just Canada or not just Ontario, and no one displaces themselves. So the technology and the environment do go together in a really positive way in that sense.
Yeah, it's true. And my sister, Avi, lives down the road from you in LA. She's reported, you can tell me if this is true or not, that the air there is cleaner than it has been in a really long time, just because the traffic is so much lower. And I know that that's true in Toronto, which is normally a nightmare to drive in, but it's almost a delight recently.
Yeah, so it's funny because until really recently, the 405, we were right on the 405 freeway, and it was empty. And it's notoriously known for always being, it's like a 12-lane highway, always blocked up. And then you gradually saw it, and that was like my barometer for what's happening with COVID. More and more people, and now there's already traffic. So I guess things are back to normal. But yeah, it was really amazing seeing everything just, And you saw also people's reaction on social media and friends, and everybody was like, got a chance to take, with all the downsides that we're talking about, also take a breath and see, come back to the nuclear families, stay at home, not be in much as a rush, understand that, things are at a different pace on that point. I wanted to, if it's okay, just to jump back to you talked about the internet connectivity 2 topics ago, and I couldn't agree more with that. And one of the things we're trying to do here with part of the coalitions in LA is look at internet connectivity as one of the social determinants of health. Understanding that if people are not connected to the internet, obviously their social determinants will be impacted.
From a northern community's perspective, we still have really poor internet connectivity up here. And the further north beyond us that you go, it's substantially worse. And so that was one of the driving factors for us to use telephone right now, was that, it was reliable and it was affordable and it was common for our target group. But what I do see going forward is as that changes, as that internet connectivity changes, and as the population who's involved in the program evolves to individuals who are more connected, there's some really great value in video. It changes. It changes your perspective, and we see it on Zoom meetings or any kind of online meetings that we're having right now. It's a lot easier to connect and understand how somebody's feeling about a conversation when you can see those social cues, you can see their face. When someone has their camera turned off for, there are all kinds of reasons why you need to, particularly where we are, so that we're not using up bandwidth. But there's value in that, and I don't think we'll ever, from a technology perspective, replace physical contact. But the audio and video is getting it's getting closer to life. And like Avi said, we may not get back to the normal we knew, which to a certain extent was excessive and all kinds of other negative connotations to the way we used to do things. And so I'm hopeful that technologies, basic technologies and activities like we do, and really technical and more advanced things like Avi's company are doing are going to help that connectivity. I know that with that step back that Avi just talked about, I am communicating with my family, my extended family, way more than I ever did when pre-COVID, when life was ridiculous.
Yeah, it's the same for me. My husband and I are the only ones of our family in Canada. The rest of our families in the United States or around the world. And we're actually talking to our family more now than we did before. So, it's obviously it's different when people have grandkids or whatever that they normally are used to interacting with and they're not able to. But there is this sort of this flip side. So I guess wherever we can find these silver linings, we have to recognize the grieving, as Christine mentioned, is very real, and the loss is very real. But we also, wherever we can find these silver linings, I think that's, there are, some things that are going to come out that will make our lives better, more focused, more mindful, perhaps in the future. I think that for a lot of people, we've heard this through this discussion, that a lot of people, it's sort of helped them understand what's most important in their lives. I've seen a lot of people sort of saying, what, I used to do this, and that, but I'm going to pare it back and just focus on this, which, my love of singing with others, or my love of, volunteering, I'm going to just focus on that. And, so there's been sort of a breather, if you will, for people. The other thing that came across in all of the comments for me was the importance of making sure that solutions are really accessible and are meeting the needs of diverse communities. So as Christine mentioned, older adults in and of themselves are not a group. Just like when we talk about the Black community, it's not a group. Indigenous community is not a group. Women, not a group. And we have to be able to recognize those diverse needs and make sure that we're addressing the needs for people, and that the solutions that we're coming up with are accessible. Because if we're only innovating for upper middle class white Western European folks with a lot of money and resources to spend, it's not going to be making the biggest difference, especially in a time of COVID where some of the folks who have the fewest resources are the ones that are being the most impacted. So whatever we can be doing right now to be helping people from diverse communities is really critical. We always like to finish with giving each of our guests an opportunity to say something, provide a resource, and one can be a selfish resource, and one can be a selfless resource. So for the companies, it's easy. Your selfish resource is usually your own company, but the selfless resource can be whatever you think would be a useful resource people can turn to add to the conversation that we've been having today. So we can maybe let's start with Avi, because I think you have something in mind already that you want to share, and then we'll go around and say, so what, maybe one sort of final word from each of you, and then a selfish and a selfless resource.
Sure. So final, word is thank you. This has really been inspiring discussion, and I really, really enjoyed it. So thank you, Kathleen and Christine and Dallas and Allison and the rest for making this happen. Selfless is a book that I'm reading now. It's called Together by the former 19th Surgeon General of the United States, by Vivek Murthy. And he talks about he was the first Surgeon General to really put loneliness and isolation on the pedestal and saying, hey, this is something we need to deal with. And it's really an inspiring book and a different perspective of a medical doctor, the chief surgeon, general surgeon talking about that. So also some great examples there. Just one short one he gave there around volunteering. He gave an example of an older woman that was coming in to the hospital for grieving. She lost her husband and she didn't feel well physically because of that. And what came out of that, she started volunteering as with younger moms, just coaching them twice a week, and it really dramatically changed her physical conditions. So that's I'm really enjoying that book, and I think that's a share. Selfish is what we're up to. We're working exactly with the types of communities you discussed. So mainly more diverse, lower income individuals, working with different populations, community. We meaning Uniper Care. Through very similar to what Dallas is doing, only one other step on the technology. So taking the phones, which are amazing, to the video conferencing, allowing people to connect not only to family, but to friends, peers, activities, lectures, health, and different providers. So all through their TV or whatever screen that makes sense to them.
Thanks. Dallas, do you want to give us a final thought, a selfish and selfless resource?
Sure. So, as a final thought, I really appreciate this opportunity to be part of the podcast. As you alluded to with my intro, I've been involved in home care and for many years, and it's always been an issue that's been dear to me, is the education part of all of this, of what we do. And so the selfish for me is really easy, of course, and that is the Without Walls programming. It's certainly across North America at this point. We have our little silo here in northeastern Ontario, but there are many, many programs that fall under the Without Walls community. And so look for those. They will likely exist somewhere in your region or are available through technology. The selfless resource is a little harder for me, but I would say, really knowing that everything's connected, find a passion and find a way in this new world that we have for an outlet for that passion. And age doesn't matter. Everyone has something to give. And we all need to be open to that. So it's not so much a resource as a thought for everyone's sake. Give and be open to receive.
That's a great thought. Kathleen, you want to share a final thought and selfish resource?
Yes, and I just wanted to say thank you so much for inviting me to be part of this. I've really enjoyed it, and I know I was nervous at the start, and that very quickly went away. So thank you to everybody for helping my nerves go away. I found this very, very interesting and very worthwhile. In terms of resources, I'm going to start with what I think is the selfless one first. I am a hospice volunteer, and I came into that just because of some of the losses in my own life. Again, it's a way to give back from what has happened to me and what I've learned. And one of the books that I have used for myself is called Healing Your Grieving Heart, 100 Practical Ideas. And I've used that for myself, and I quite often will use it with the people that I interact with through being a hospice volunteer. And it's just very basic, literally is 100 ideas, and be aware that grief affects your body, heart, social self, and spirit is one of them. And that each tip is like a one-pager. And it's very practical, and I found it really helpful. For the selfish, comedy. I find that really, really helpful. And there's a little group of us who perhaps share the same sense of humor, and we share these cartoons back and forth on our internet. So Maxine, Anti-Acid. There's a comedian called Mrs. Hughes. So all of that kind of humor, and it's very specifically geared to, I guess, our age group, and I think women in particular. And we find it hilarious and enjoy that. So I guess that's my selfish resource.
Thanks so much. Christine, final word and resources?
Yes, I turned my video off because I was getting the message my internet connection was unstable. So I hope I'll at least be able to get through
Better your
this.
internet connection than you. So
Probably both at this point from months of isolation. Thank you very much for this opportunity. I'm very grateful to have the chance to participate in this. It's been very interesting and inspiring. For my final comments, I just wanted to mention a few other things that I thought of that would, forms of technology that would make my life better. And then I've got one thing to share in terms of the selfless sharing. I've been engaging in physically distanced walks with friends. When we're trying to stay one full hockey stick away from each other, we sometimes find it's hard to hear each other, especially when you're out in public, without yelling, and you don't always want to share your conversation with everybody all around you. So if there was some simple technological way in which we could actually talk to each other somewhat privately while maintaining physical distance, I think that would be really useful. So in terms of sharing resources, I thought I'd just mention the singing group that I'm part of. It's an open group. You don't have to be a good singer. You don't have to already know the songs. The songs are taught each time, line by line. They are relatively simple. The melodies are beautiful. Most of the lyrics are really positive and encouraging. So the group is called Soulful Singing, and it's led by a woman here in Kingston, where I am, and called Wendy Luella Perkins. But as I said, people participate from all over Canada. We've got a group in Winnipeg. We've got a group in Halifax. We've got a group in Montreal. We've had people from New Zealand, from Argentina. It's absolutely wonderful. Anybody who wants to participate, I have permission from Wendy to give the contact information. Her email address is info@wendyluellaperkins.com. And Luella is Luella. I strongly recommend it. You just have to contact her and she will send the information for the Zoom calls. And we welcome having more people. It's really, really wonderful to see people from all over.
And maybe we can get get you and that group connected in with Uniper's programming and Senior Centers Without Walls programming and get it spread even further. Thanks to all of you for joining us on this special CABHI Community of Innovation podcast in collaboration with Baycrest Home. I want to thank again our guests, Dr. Christine Overall, Kathleen Ellis, Avi Price from Uniper, and Dalas Forget from Timiskaming Support and the Senior Center Without Walls. And thanks also to our funders, the Ontario Ministry of Colleges and Universities, Baycrest Foundation, and so many public and private sector partners. To learn more about CABHI, you can visit us at CABHI.com, CABHI.com. And for more information about Baycrest at Home, you can visit their website, which is simply baycrestathome.com, all spelled out, BAYCRESTATHOME.com. And I'll give you one additional resource, which is a selfless resource in the spirit of Christine's musical recommendation. I have found it's very frustrating if you're into music not being able to be among your people, listening to jazz or whatever. And the idea that these small jazz clubs are going to be opening up anytime soon is not likely. If you're interested in that kind of music, I would recommend smallslive.com, SMALLSLIVE.com. Smalls is the most phenomenal jazz club in New York, and tiny club, amazing artists all the time, and they have an archive of all of the. They normally live stream for free all of their concerts. So even though I don't live in New York, I can still go there. And now they have the archive of everything is open for people. So if you're into any kind of jazz music, I highly recommend smallslive.com. And I just want to say thanks again to everyone for joining in the conversation. People won't know there are a lot of people sitting there quietly in the background. You heard from Simon initially. He and Rosanna Aliang are our two co-executive producers, and also in the background making things run very smoothly were Soren Chulhar, Linda Trong, Jacqueline Baptiste, and Ariel Townsend. So thanks to the whole team that you heard and didn't hear for making this possible. And, we just wish all of our listeners to stay safe and stay well. Thank you very much.